my dear friends, Korean friends, and Western California members. My name is Dr.Aldan의료법, and I welcome you back for another informative presentation. Today's topic is an overview of good and bad cases dealing with alternative medicine and attitudes towards medicine as a whole in America. In the United States, people of all backgrounds use complementary alternative medication. However, complementary alternative medicine used among adults is greater among women and those with higher levels of education and higher income. Approximately 38% of adults, which is about 4 in 10, and approximately 12% of children, which is about 1 in 9, are using some form of complementary alternative medicine. Now, people use complementary alternative medicine for an array of diseases and conditions. American adults are most likely to use complementary alternative medicine for musculoskeletal problems such as back, neck, and joint problems. The use of complementary alternative medicine therapies for head or chest colds showed a substantial decrease from 2002 to 2007. So they were mostly used for musculoskeletal problems. In recent discussion from several individuals have expressed their personal experiences with conventional alternative and medicine, and of course complementary alternative medicine, which is more towards traditional medicine. And their overall opinion and attitude towards medicine in general were stated. Now, in the following segment, I will be reading true accounts and cases of individuals who have used some forms of complementary alternative medicine or traditional medicine in their lives. They have all used aliases or usernames to post their discussion or opinion regarding these complementary alternative medicine or traditional medicine. A person whose username is Plenty responds, I have actually found that acupuncture is good for pain management. I have a bad knee and I get regular acupuncture treatments to help deal with the pain. My knee often feels better after acupuncture, and the treatments can even reduce swelling. Over the 6 months or so that I have been going to treatments, I have been able to go back out to the golf course or play basketball again. Now, it has definitely been better alternative medication than taking daily medication or surgery. I am a firm believer that alternative medicine therapy is the benefit and the real way to go. Another individual whose name is Cougar has talked about his use of acupuncture, and it's along with minor surgery. He had treatments for smoking, and he has been able to cessation, and they have worked better compared to expensive drugs on the market that he uses. The treatments are also a lot cheaper than the drugs he would normally use to stop his smoking habits. He has quit about 2 weeks, and his urges don't even come back. He has not smoked cigarettes since 3 years now, with acupuncture as a treatment for his smoking habits. Another individual whose name is Highlighter uses herbalists, and they talk about how the government would allow, if only they would allow the FDA to classify many herbs as medicine, it'll actually carry out studies that could prevent or even find cures for illnesses. Now, another individual whose name is Kendon says that I wonder if alternative medicine is really good for me. Well, in response to that, he tried it out. In 10 years now, he's been using alternative medicine. He says, I'm a firm believer that alternative medicine, for example, acupuncture that I've used, is amazing. Some hospitals in China, up to 80% of surgical operations have been performed by acupuncture versus doing surgically removed operations. Now, patients are given choice, and they either have conventional anesthesia or acupuncture, and they actually go in that direction, and they have no side effects compared to anesthesia. Herbs is also one that I've tried, says Kendon, and says It's very much interesting. He didn't know that garlic was actually significant in lipids, lowering cholesterol, triglycerides, and low density. Lipoprotein and had made used in the treatment of hyperlipidemia. Now, another powerful antioxidant is green tea, which is used, and there's tons of studies that have come out with green tea. Alzheimer's disease and infections, the antioxidants in the green tea contains the EGCG, and most researchers, famous researchers now, are using or going into the research of this chemical that is in the green tea. Another individual in the end is actually a physician. He believes that he was also, his grandfather, who is also a general surgeon, was trained in Western medicine. He took his residency in New Jersey, but believe it or not, his grandfather used acupuncture, and that's how he was influenced. He quotes, "When my family members are sick, we would go to my grandfather and undergo acupuncture. It has worked very well. My grandfather also has cured cancer patients with acupuncture, given that they're mild and they're earlier detected." He was featured on TV. He is still practicing up to this day, but he's quite old, and so you might want to take a look at an individual who's actually younger. I plan on studying acupuncture to supplement my medical studies in the future. Now, another individual whose name is Vint says that, "I take Ayurveda medicines. They're very costly. They might charge you up to $50 to $60 for a single consultation, but you may not have to go to a doctor ever again in some years. So in the long run, I actually save a lot more money." Another individual whose name is John says that, "I take herbal and alternative medicine. They're very powerful, and it should be used in conjunction with conventional medicine. But always consult with the doctor and see what is the undesirable effects in case the two might conflict." Jamie, on the other hand, another individual, says, "You're right, the alternative medicine is very good. It should be practiced by a doctor specialized in experience." I'm a medical doctor himself. This Jamie is a medical doctor. I've experienced the alternative medicine, and I think it actually works very well beyond doubt. I think emphasis should be given to alternative medicine or traditional medicine to find better place in research fields and so on. I guess it's only in China and rural Indias and of course in the Pacific that most of these type of medicine is practiced. So I would hope that the industry would spread out wide in that location, in that area too. As we have seen and heard with these testimonies and the various surveys, it is evident that more and more people are swaying towards using complementary alternative medicine or traditional medicine, types of herbs, Ayurveda, acupuncture, homeopathy, naturopathy, whatever it is that is complementary alternative medicine, approaching a more holistic and natural way to relieving ailments. Over the course of the years in medical history, individuals have taken this up. Attitudes towards conventional methods is changing due to reasons such as serious side effects of conventional medicine that it causes. Synthesizing the medicine to trigger one area actually has a cost. It actually releases the side effects. High cost is also an issue. A complementary alternative medicine is much more affordable compared to the conventional medicine. And the chances that it will do more harm than good with conventional medicine, the patient is actually more geared towards the more natural, more or less, and the more all-natural way of how Mother Earth does with their body. Although conventional medicine is targeting the ailment directly and produces faster and quicker results, most people in the United States' attitudes or viewpoint now are more health conscious of the end result, weighing their options based on the long-term basis, not on the immediate effect. Therefore, we see the trend or the fad in the medical scene where individuals in the United States are integrating the conventional medical use with traditional or complementary alternative. In conclusion, the evidence is clear and has shown that this lucrative method is not a gimmick or a phase that is temporary and is only going to be seen just once in a lifetime. Alternative medicine, complementary alternative medicine, or traditional medicine is here to stay permanently. in the medical scene for the public. Take this opportunity to look into the many various profitable ways alternative medicine can offer to the business world and to the public. Thank you, and remember, health is wealth.